people with peanut allergies is growing, something that could kill them if they're exposed to something as simple as a peanut. But as Patrick Fazio shows us, there's a new treatment option that's now available here in Kansas City.
If I get exposed to a peanut, then I will have an anaphylactic shock, which could kill me.
Doctors first diagnosed Sophia Valdez with a peanut allergy at 2 years old. Her mom has worried about the risks ever since.
It's a little bit harder to manage as she's getting older. Going out to eat is quite the challenge.
The Valdez family also worries about Sophia being exposed to peanuts at school, birthday parties, or even a friend's house.
She could have as little as 5 minutes to get epinephrine to save her life.
You're right.
Sophia just started peanut desensitization therapy, now available at a private practice in Kansas City.
Good.
Here's how it works. Patients are slowly introduced to peanut protein with increasing doses each week.
If they get an exposure to peanut, it protects them from a reaction.
Dr. Derrick Ward added desensitization to his clinic at Kansas City Allergy and Asthma after patients kept asking for it.
There's not a lot of clinics in the United States offering this treatment. There are probably around 30 to 35.
A medical study in The Lancet found desensitization works for nearly 85% of peanut allergy patients.
So 15% of people will ultimately fail, but it's not necessarily because they are having reactions. We've had some kids that they just don't like the taste of peanut.
Patients who finish the 6-month therapy program are then supposed to eat 8 peanuts every day to maintain their desensitization. But not everyone thinks this is a good idea.
Once the patient stops the peanut, therapy, then what happens? Have they completely outgrown it?
Dr. Chitra Dinakar at Children's Mercy says new research is inconclusive on peanut allergy therapies like desensitization.
The scientific community say really it should be limited to research studies. So the risks are that they could have a systemic reaction.
Telling them that a reaction can occur is really nothing new to them. That's what they deal with on a day-to-day basis anyway.
That's why patients are willing to try desensitization even though it's not widely accepted.
You eat 3 times a day. So 3 times a day, we have to worry about whether or not she's going to be safe.
Christina Valdez hopes desensitization works for her daughter so she can live a normal life.
It will be like a really big relief.
For now, they still have to worry about accidental exposures that threaten her life wherever she goes. Patrick Fazio, 41 Action News.
Now, Children's Mercy Hospital plans to do research studies to test peanut allergy treatments on patients. Meanwhile, Kansas City Allergy and Asthma hopes to add more foods to its desensitization program, like other nuts, maybe eggs, milk, and wheat.